Today we are going to talk about antibiotic resistance from a business perspective. A company typically organizes its activities, resources and investments to develop a new product, let's say a new generation of smartphones. With the perspective of selling many of them so they could recap the cost of R&D, manufacturing and marketing, and at the end of the day making a profit. Now, companies present in the antibiotic field are facing a big economic problem. As you already know by now, society needs new antibiotics. But at the same time, we need to reduce overall consumption and misuse to avoid the increasing resistance problem. In economic terms, this means we are asking companies to invest more in R&D, but at the same time to sell much less of what they come up with. Bottom line, companies do not see this as attractive or profitable business. They limit their investments and they even decide to leave this market. Now, how can we tackle this rather critical situation? How can we increase, on one side, the antibiotics R&D and improving its possible use and access worldwide on the other? This is a complicated question that does not have a single straightforward answer. First of all, we need to better understand the value of antibiotics from the perspective of physicians, patients, payers, and society as a whole. Then we need to consider, on one side, the specificities of the different stages required to develop a new antibiotic, and on the other, we need to consider the specificities of the countries and markets around the world. Many changes and initiatives have been discussed recently, and not only in Europe, but also worldwide, and I'm very optimistic. See, for instance, the Global Action Plan proposed by the WHO, or the White House plan, or the WHO and the UK reports on these matters. Also, IMI offers different initiatives and reports which you can consult in this course session. There are also several ongoing projects that you can refer to. For instance, look at the report from the Uppsala Health Summit 2015 and at the Drive AB website, where a lot of information is about possible solutions to this big problem. From the work done so far, some core ideas are apparently coming out and lead the way. Now, I want to focus particularly on three of those: the linkage, cooperation, and a systemic approach. So first of all, many advocate the necessity to adopt a delinkage model as a solution. For instance, see the Chatham House report, also on this session of the course, which illustrate a lot of information about possible delinkage methods. Delinkage means introducing mechanisms that separate the sales from the profits. Now, what this means is that you could introduce, for instance, reimbursement for companies that are engaged in R&D in antibiotics and that they reach a certain success along the path. It could also be done by providing prizes to the successful projects. Obviously, also there could be some subcontracting or tender made by agencies or government bodies which would take away the pressure of sales from those that are involved with R&D efforts. These and other delinking mechanisms aim at sharing risk among different stakeholders and providing a return for those that actually are carrying out R&D, which is not linked to sales. The second aspect is cooperation. Specifically, I mean the necessity to increase the sharing of R&D efforts between different organizations. Both private, small or large companies, but also public entities, such as universities, agencies and governments. New private-public partnerships are to be explored, so to share the risk and economic burden of the new investments. Platform for providing cooperation and sharing of knowledge needs to be created as well. No company or organization alone can reach breakthrough within the current market situation. Most important, initiatives need to be coordinated internationally as much as possible, and particularly so if we want to improve not only innovation output but also stewardship level. The third and last aspect is the necessity to adopt a systemic approach to the antibiotic resistance problem. On one side, The development of new antibiotic already presents many steps along its value chain that necessitate different interventions by different actors and the use of different pull or push mechanisms. Have a look, for instance, at the publication provided from the American Journal of Law and Medicine, which does such a type of analysis. On the other side, we cannot only focus on developing new antibiotics, but we need also to intervene and better regulate and control use and access. This means a huge effort in coordinating and matching proper interventions together in order to manage in an optimal way what is, at the end of the day, a very complicated economic equation. Thank you very much.